This is Democracy Now!, democracynow.org, the Quarantine Report. I'm Amy Goodman. It was a year ago when the United States confirmed its first COVID-19 death, and then President Trump vowed the coronavirus was, quote, very well under control in our country, unquote. By the time President Joe Biden took the oath of office last month, the U.S. death toll from the virus had crossed 400,000. In the last month, 100,000 more people have lost their lives. At a sunset ceremony at the White House, President Biden, Vice President Kamala Harris, and their spouses led the country in a moment of communal mourning as COVID deaths passed 500,000.
Today, we mark a truly grim, heartbreaking milestone. 500,071 dead. That's more Americans who have died in 1 year in this pandemic than in World War I, World War II, and the Vietnam War combined.
Biden has ordered flags on federal property to fly at half-staff for 5 days. The number of new COVID cases continues to fall across the United States, and the vaccine effort is speeding up. This comes as the head of the World Health Organization is calling on rich countries not to undermine efforts to get vaccines to poorer nations by buying up billions of doses, in some cases ordering enough to vaccinate their populations more than once. For more, we're joined here in New York by Dr. Craig Spencer, Director of Global Health and Emergency Medicine at Columbia University Medical Center. He's been treating coronavirus patients since the pandemic began a year ago. His recent Medium piece headlined, "Global Vaccine Inequities Are Dangerous for Everyone." Dr. Spencer, welcome back to Democracy Now! This is a horrific milestone. 500,000 people dead in the United States. We have less than 5% of the world's population, but about 20% of the world's deaths and infections. How did we get to this point?
You know, a year ago, I remember in New York City, we hadn't had a case yet. We had been hearing about cases all around the country and obviously all around the world. Italy had been hit hard, was starting to be hit really hard. And we were prepared here. We knew that things in New York City would get bad, but we had no clue that they would get as bad as they got. And we certainly didn't think that it was going to be this bad all around the country for so long. You know, part of that is because this virus is really good at what it does. You know, a year ago, less than a year ago, Dr. Fauci said we may have 240,000 deaths. We've doubled that already, and there's certainly going to be more. But obviously, and what I've been saying over the past year is that a lot of this, you know, this death toll and a lot of this destruction that this virus has wrought on this country and this world was because of our failure to adequately respond and to treat this like the public health crisis that it was. You know, so much over the past year, we have undermined the scientists. We have, you know, belittled the public health measures and the things that we could have done to get this virus under control. And because that wasn't done largely by this last administration, the Trump administration, what we have now is we have, as you've already noted, the most cases in the world, the most deaths in the world, and, you know, now passing this grim milestone of over 500,000 Americans and counting who have died from a virus that we could have certainly controlled a lot better had we taken it seriously a lot earlier on.
I want to ask you about vaccines. The first about what's happening here and then in the rest of the world. You have 2 vaccines that have been approved in the United States. We still don't quite understand what it means for the vaccines to outpace the variants, the British variant, the South Africa variant. Are they going to have to change the formula in these vaccines to deal with this? And those that have these vaccines, will they have to get new shots? And then how do more Americans get shot at this point?
Those are all great questions. And the one thing that I want to point out, because this can be a little unclear, right? We see a bunch of different headlines and are the vaccines working? Are they not? Let me make this very clear. The vaccines that we have right now, the Pfizer and the Moderna vaccine, are both extremely, extremely, extremely effective at preventing you from getting infected with COVID and fantastic at preventing hospitalizations and deaths from COVID. I mean, they are truly miraculous, and the fact that they were done in such a short period of time is a game changer. So I want to encourage everyone to please get vaccinated when it's your opportunity to do so. Now, there have been some concern because there are these variants. We've heard of variants that have emerged out of the UK, out of South Africa, now some out of California. There will likely be many more. And there have been some studies, both in the lab as well as in a larger population, showing that for some of the vaccines, their effectiveness may be blunted by some of these variants. That being said, they've still all prevented hospitalizations and they've all prevented deaths. The fact that there have been no deaths and no hospitalizations in severe cases in the vaccine arm of these research trials is truly, truly remarkable. So yes, there will have to be some update likely over the next year, and perhaps even going on in the next few years in terms of the recipe or the formula for some of these vaccines. We know right now that they're very protective, and we know that the FDA has already has given guidance saying that we're not going to have to go through and do these whole 30,000, 40,000 person trials like they did initially for these vaccines. They'll be able to tweak the vaccine like they do on an annual basis for the flu shot, which would make it a lot easier for us to get this updated vaccine out to make sure that people are protected should variants emerge that undermine the efficacy of these vaccines.
So these vaccines are based on a new technology, messenger RNA. That's Moderna and Pfizer. On Friday, the FDA advisors will be meeting to discuss emergency use authorization for Johnson & Johnson's COVID-19 vaccine, which is adenovirus. Is that right? Can you explain the difference? That also is a one-shot.
Absolutely. So the Pfizer and the Moderna vaccines have up until now been a bit complicated because they were 2 shots. They had previously been required to be at these really, really cold temperatures that made it logistically difficult for many people. The beauty of the Johnson & Johnson vaccine is that it is a well-known older technology that has been shown to be very effective. And as you pointed out, it's a lot easier to transport. It's a lot easier to manage. It's a lot easier for smaller places, rural pharmacies, places internationally to manage. And it's also great because it is just one shot. So you get rid of all those logistics of thinking about whether people need to come back in 3 weeks or 4 weeks and what happens if they miss that or it needs to be delayed. So there are thankfully, multiple vaccine candidates on the horizon. Hopefully we'll get a little bit more nuance in terms of which ones are better for certain populations. But what I've been telling people right now is that if you are due to get a vaccine, if you're able to get a vaccine appointment, you should take whatever vaccine you can get. I wouldn't wait to try to get a Pfizer or a Moderna or a Johnson & Johnson. All of them, I want to repeat this, all of them have been proven to prevent severe COVID, prevent hospitalizations, and prevent people from dying from COVID, which is obviously the most important as we pass this horrible milestone.
You wrote in your Medium piece that's headlined, "Global Vaccine Inequities Are Dangerous for Everyone." I've personally received more doses of a COVID-19 vaccine than 130 countries. Dr. Spencer, explain.
I was lucky enough as a healthcare worker here in New York City to be part of the initial phase of the vaccine rollout. I was extremely eager after having seen and been at the bedside of so many people dying over the past year from COVID and worrying every time that I went into work that I'd get sick myself and pass it along to my family. I was one of the first in line to get vaccinated when I could. That was 2 months ago. And in that time, there are still over 130 countries that have not received a single dose of vaccine. There was at one point, just a few weeks ago, where the only country in sub-Saharan Africa, one of the only countries in sub-Saharan Africa to get vaccinated was in Guinea, and they received 25 doses, not 2,500, not 25,000, but 25. We all knew that there was going to be an inequity. We knew that wealthy nations were going to gobble up vaccine doses like they've gobbled up many other technologies for time immemorial, quite frankly. But the inequities that we've seen here are just absolutely stunning. The wealthy nations and advanced economies have bought up well over half of the vaccine doses via, pre-purchase agreements, despite representing a fraction of the global population. Now, part of that is because COVID has been worse in places like the UK and Europe and in the United States. But that does not mean that it has not touched sub-Saharan Africa and other places around the world. There's been nearly 4 million confirmed cases in Africa itself, with over 100,000 deaths. And there's concern about a recent rise in cases there as well. My concern is that I've been vaccinated, thankfully, but my friends who work in a clinic in southern Burundi in East Africa may have to wait until 2022 or 2023 before they have a chance to get a vaccine, even as we're being promised here in this country that everyone will have a dose by July. And we have, via pre-purchase agreements in the United States, ordered way more vaccine doses than we have people who are even eligible to receive them.
According to President Biden, 600 million doses the U.S. should have by July, which would mean 300 million people vaccinated if it's 2-shot. Of course, 1-shot, then it's way more. But explain why people who in this country only care about what's happening here, even using that criterion about survival of people in the United States, the worst in the world, should care about what's happening to people all over the world?
That's a great question, right? Because we have seen so much pain and suffering here at home. We've seen what's happened with our economy. We haven't been able to eat in a restaurant. We may have lost loved ones. It's easy to see the proximate impact of COVID here and why we all want it to end as quickly as possible. You pointed out the 300 million people by July will be able to get vaccinated. Well, that's just for adults, right? So that's 260 million people that we actually have eligible for vaccination in the U.S. We haven't done trials on kids yet. So that means we have 40 million more doses just of Pfizer and Moderna than we do people who will be able to be vaccinated by that time. We also have Johnson & Johnson doses, others, hundreds of millions of other doses that we have ordered. Now, we can hold on to them and hoard them, or we can think about how we get other vulnerable populations around the world vaccinated. There are 59 million healthcare workers in the world. We could take a very small proportion of the doses that we have ordered, and we could help coordinate a program with the World Health Organization, with other international health bodies, to get those most vulnerable people in the world vaccinated so that not only are we safe here at home, but others are safe everywhere else. Now, there are other reasons why that's important. Stopping the virus from replicating in Missouri is just as important as stopping the virus from replicating in Mozambique. The more that this virus has a chance to mutate, to replicate, it has more of a chance to mutate. And that's where you can get these concerning variants that may develop in other places that could land here and could possibly undermine the efficacy of our vaccines. The other really important thing is that we all want to get back to work. We think that getting vaccinated may be really the jumpstart to the economy here in the U.S., but so much of what we rely on in our U.S. economy comes from abroad. Car parts from other countries, everything that we need largely comes from other places. And if those places aren't able to get back to work because they're still dealing with COVID outbreaks, the economic toll here in the U.S. could be huge. It's estimated that up to $9 trillion hit on the economy will occur in 2021 alone if we continue with this vaccine nationalism, just gobbling up all of these vaccine doses for use in wealthy countries and not thinking about other economies and other people around the world. The economic devastation could be huge, not just in those places, but here as well. So it's in our public health interests, it's in our economic interests, and I think most importantly, it's really in our ethical and moral compass to be doing this. This is part of our role.
And finally, this has exposed the racial disparities in healthcare and economic disparities in this country, to say the least, like an X-ray. Dr. Spencer, can you talk about something that is left out of, in the networks, the corporate networks, there is a lot of discussion of the horror in this country. But what about the solution? What about Medicare for all?
It is unbelievable to me at this point that despite being the wealthiest country in the world, despite spending the most on healthcare per person by far of any country in the world, we still have tens of millions of people who every day remain unprotected and uninsured. Look, as you pointed out, this pandemic has really shown a light on how bad that was. We've seen Black and brown populations who've been disproportionately impacted by the impact of this pandemic. A lot of that was because, yes, the virus itself and the conditions around it, but because of the system that existed and the infrastructure that existed or didn't exist for those populations beforehand. We need to do everything we can to recognize that, again, like vaccines, the economic benefit would be huge of making sure everyone had health care. We need to, from a moral and ethical perspective, to make sure everyone who lives in this country has access to a doctor and doesn't have to worry about going bankrupt because they're looking for treatment for something that has ailed them and prevented them from either working or going to school or contributing. It's absolutely essential that on the other side of this, we don't just go back to normal, because normal was absolutely unsustainable, completely unacceptable, and we need to reimagine how we get everyone part of our economy, part of our workforce, but most importantly, healthcare, and make sure that we provide, I think, really what we should assume are the fundamental tenets of an advanced and humane healthcare system here in the U.S. And that doesn't happen until everyone is covered and has health insurance.
Dr. Craig Spencer, President Biden has called this a war on the pandemic. Could you imagine a world where the United States pushes vaccine, both giving and selling vaccines around the world, as hard as it pushes selling weapons of war?
Well, we certainly would be a lot safer if we got everyone vaccinated. Look, there's been, here in the U.S., we've had 500,000 people die. We've had at least 2.5 million people die from COVID around the world. We've had over 100 million infections. And look at the economic impact that this has had here in the U.S. $3.4 trillion already passed in stimulus, another 1.9 likely coming very soon. The impact has been huge, greater than many, many, many wars. It is imperative that we get COVID controlled here in the U.S., but it's also imperative that we get it controlled around the world. And in addition, how we think about how we prepare and respond to the next crisis. We can't build walls or tall enough or moats wide enough to keep out the next invader, whether it's a microbe or a virus. We need to be prepared, because we will see this again. We've had multiple public health emergencies of international concern over the past 6 years. We will have more of them again. We need to be prepared and make those investments now. Part of that is making sure people here at home have access to health insurance, as you've already pointed out. But part of that is making important investments in getting people vaccinated around the world, helping build health structures and health systems that can detect and respond to those threats before they reach our shores.